Hi there, Dr. Diane here, and I'm here with Aaron. Say hi, Aaron.
Hey guys.
Aaron's been coming to us for years for various problems, but today he presented with a foot problem that he's had for 6 months. It started after he was wearing hard orthotics, and he's describing symptoms of plantar fasciitis, and after the examination, that is exactly what he has. What happens when you first wake up, Aaron?
It's like really hard to step on I can't even put pressure on my right foot.
Yeah, so that's a classic symptom of plantar fasciitis. The first few steps are hellacious, and then it kind of loosens up and gets a little bit better, but if you sit too long, then you can hardly walk again and things like that. A lot of the pain is right through here. So what we're going to do today is we're going to use the myofascial acoustic compression therapy machine, the MyAct machine, to help stimulate the healing response. And then we're going to scan his feet so we can get him in a soft, cushiony pair of orthotics so that he doesn't have to wear the hard orthotics that were part of this problem. And then he will come in 4 more days and get another MyAct treatment. Typically, plantar fasciitis takes 3 to 5 visits. I've even had cases of plantar fasciitis that were lasting more than 5 years, and we were the only people that could help get rid of that with the MyAct machine. So, and it does really work well. So now we'll go ahead and start treating Aaron's foot with the MyAct machine.
Great, let's do this.
So hop up here. Get you on your tummy here. Take your glasses off. Okay, take that. Very good. Okay, Austin, we're ready. And you'll lean forward. So Austin is the assistant here that does the MyActs. Look at these calves you have, Aaron. They're like massive. Okay, so he is ready.
All right.
And you are being videoed, Austin. Just so
Oh,
you know.
thank you for the heads up.
All right, great.
What's up, Coach?
Howdy. All right, so your responsibility in this is just to let me know what you're feeling. We'd love to find something that kind of mirrors your symptoms in a lesser way, so it's not excruciating, but you definitely want to feel it, for sure. So we're going to start off nice and low here on some common points, and just let me know what you've got. It'll feel kind of like a toothache in there a little bit.
So when I feel that, just tell you to stay there.
Exactly. Is it worse in the morning and then as you get strolling better? Yeah.
Mornings are worse.
Yep.
Stretching helps.
Yep. So anything standing out so far?
Not yet.
All right.
Austin, what's one of the biggest benefits to this machine, and why, other than plantar fasciitis, which you're treating now, what would be some other great things people would want to use this machine for?
Real quick, are you feeling that now?
Yeah, right there.
Okay.
Yep.
So he's feeling that as this Achilles kind of comes down and becomes the tissue of the plantar surface, as those meet, that's where we're getting some soreness. So we're just going to hang on that until that lets go, and then you'll let me know that it's backed off, and we'll move on to another spot, right?
Yeah, it's backed off.
Okay, good. So that was quick. So the first couple of thousand pulses is us getting the intensity dialed in, and that all varies on part to part. To kind of get back to your question, so say we're working on a knee, we would change the depth, we would change the intensity to get in some different structures in there. With this, the far extremities tend to be a little more sensitive, so we use a shallower depth, and we don't need to hit as high intensities. So, but yeah, I mean, tennis elbow, if you've got golf situations, trigger point work in the upper back. We do low back, like if your low back's blown up, it can be really, really helpful. We do tons of knees with this, tons of knees.
Aaron, how does that feel?
Feels good. I can tell every once in a while I get to a spot where it's like working.
So let's find another sore spot here. As we come kind of toward the inside of the heel, how's that feeling? Is it a little stronger there, or are we off of it?
It's not on it right now.
Okay, good.